Hey guys, Dr. Justin Marcagiani here. Today we're going to be talking about low-level laser therapy for your thyroid. I'm a big red light, infrared frequency laser guy. I use laser devices for my hair. Right here, my favorite little device. I use the Capillus cap on my hair. It's got about 300 different lasers in there, really powerful. This uses that red light frequency in that mid 630 range. And then I have my Avant laser, which is my newer device here. It's a class 3B FDA cleared laser, very powerful. It's got a 635 nanometer frequency, which is that red light. It's about 1,000 milliwatts, very powerful. And I also have, this is the LZ30. And there's also an infrared frequency around 805 nanometers on there. So I love to use this on my thyroid. Technically, it's contraindicated because you actually stimulate the thyroid and you can actually decrease your need for thyroid meds, which can then cause you to go hyper if you're on meds and you're not testing your thyroid to potentially lower your meds. Lots of studies with the 635 and the 805 frequency on helping to reduce thyroid antibodies and inflammation, echogenicity, and actually lowering thyroid medications. Okay, I would only recommend you do something like this under the watchful care of a physician. So if you have to lower your meds, you can, or your hormones, but this is a powerful device because most thyroid issues are autoimmune in nature. So this is really cool here. I'm gonna turn this guy on here for you. Okay, so I have my different protocols in here. So what I would typically just do, I'm gonna just do my inflammation and swelling setting. And I have it set for mine. So it oscillates 20 seconds on red light. See the red light behind me? And then it'll switch over for 20 seconds to infrared. You'll see it kind of go lighter. So that's the red light. Obviously, it hits my eye. That could be not so good. I have glasses here, but I'm not going to hit my eye. And then in 20 seconds, it'll go to infrared. Watch it switch over. Boom. So it's got two diodes. So I'm actually getting the 805 nanometer infrared as well as the 635, 637 red light. And again, it's 1,000 milliwatts for the red light. Very powerful. And then it's about 1,300 milliwatts for the infrared. And so if you're worried, I have my little handy dandy glasses that come with it actually neutralize it. There's a green to neutralize it, no big deal. And I can go right on that thyroid gland. So if you find the Adam's apple or your thyroid cartilage, that little bump there, less obvious in women obviously, but feel here and it's about 1 centimeter lateral. So I'm gonna go right here. So I'm gonna do about 1 to 2 minutes right on this side, and I'll go 1 to 2 minutes on that side. That way I can get right into that tissue. That way I'm not having to go to that thyroid cartilage. And again, glasses aren't really necessary unless you're doing, let's say I'm doing here cosmetic, let's say like for wrinkles and stuff, then it makes a little bit more sense. But in general, outside of that, as long as you're not looking at it, with my kids, I'll put it on my kids because I don't trust them to not look at it, even though we give them instructions. But outside of that, if you're a responsible adult, not a big deal. So yeah, I'm gonna do here 2 minutes here. So while I'm talking about this, why red light or infrared? So infrared's pretty cool because that penetrates about 3 centimeters deep. Some research say it's even 4. Very powerful. So if I can go into cartilage, tendons, just deep tissue, and I can significantly reduce inflammation. Red light is very cool because red light can travel throughout the body. So even if I'm like, let's say doing red light here or here, my body's going to absorb that light, and it's actually going to be carried on that red blood cell throughout the body, and it can stimulate ATP production. It can help with the mitochondria. Essentially, red light is used in the body from a frequency standpoint to activate DNA. So there's a lot of things that red light is using. That's why your blood cells are red. So there is a red light frequency being emitted, hence the color of your red blood cells are red, right? So that frequency is in your body, and it can be carried throughout the body, and it can provide tissue healing. There's a story of a gorilla that had inflammation on the right side of its body, and the vet who was using laser just couldn't hit it. The gorilla would hide the pain, and so the vet said, all right, let's just do the laser on the left side of the body, and it was a red light frequency, and they saw significant improvements in pain, objective signs from the gorilla. And so red light, yes, it's better to be right on that tissue, but can also travel throughout the body, which is powerful. Obviously, closer the better. Now, infrared, you definitely want it to hit that tissue because there's powerful anti-inflammatory capacity there, and especially if it's like tendon or ligaments, it's going to have a great effect. So, if you're doing these kind of therapies, again, my book's coming out, The Thyroid Reboot, and I'm just seeing lots of patients that have antibodies that are elevated, that have Hashimoto's, and they need a strategy outside of just nutrition and supplementation. Now, what other modalities can they use? And this is a powerful one. Again, technically contraindicated, so I'm not telling you to do it. I'm just some doctor on YouTube, right? I'm just saying, if you're going to do it, let your conventional or your functional medicine doctor know, and just make sure you're running your labs more frequently. And if you're on thyroid meds, adjust it. But the goal of this for me is reducing inflammation and decreasing the thyroid antibodies, which is powerful. I got a little timer on here. It'll tell me how many joules too. So I got about 245 joules, about 3 minutes. We'll switch sides. And so you can't really do too much. If you do too much, what happens is you just hit your maximal saturation dose, and then you have this kind of fall off point where there isn't as much benefit. But I try to get it right on this tissue here. And I have it set. I set my laser up for essentially 20 seconds on red, and then it goes 20 seconds to infrared. So it goes back and forth. Typically, you can oscillate and go in and do red and then infrared and switch it, but it's just easier to know that you're getting both at the same time. 20 seconds red, 20 seconds infrared. Pretty powerful. So, my goal is to get my antibodies down. My antibodies aren't that bad. Like my thyroid globulins, like, 5 or 6. Anything greater than 0.9 is elevated. My TPO was like 50, 60, but I want to spike it. So I try to keep the inflammation down, and my thyroid, my T3 levels are like 3.8, 3.9, so the top end of the range. My TSH is like 1.5, 1.8, so not bad. My T4s are 1.2, 1.3, so pretty good levels across the board. So this is powerful modality. I talk about it in my book. I'm going to try to get some more of these devices. So if I have patients that need support and they want to rent them or get them from me, this device here is about a $7,000 or $8,000 laser. So they're expensive. This is a very powerful device. It's class 3B laser, but a lot of good benefits. And I can change settings here and do, like, let's say I want to stimulate hair growth. Let's say do my temples a little bit. I can also use that right on my temples. Again, this is a laser, which is different than a LED, right? LED is a light emitting diode. A laser basically is light in a coherent type of form. If you look at the exact definition of laser, I'll pull it up, but there's basically the difference between the LED and a laser is the coherence within it typically. Yeah, so if you look at a device that generates an intense beam of coherent monochromatic light, but it stands for light amplification by stimulated emission of radiation. It's the coherence though, where the LED is a lot more scattered. Very powerful. You can get powerful LED, but lasers going to have that synchronicity, and due to that, you're going to have a lot more of a therapeutic benefit with that out of the gates. So I hope you enjoyed this video. Hope it gives you some benefit. But I have different protocols in here that can do all kinds of different things. Ligaments, so I had a bicep tendon issue. Put this on my shoulder. I have a stand. So I'll see patients. I'll just roll up my sleeves, get the guns out, and I'll put it right there. And I'll have the stand hold it, and I'll just move it right around that tendon for like 30 minutes, and significant improvement. My massage therapist even confirmed, just kind of going in there, the tissue quality and the suppleness and the hydration and just the bogginess was significantly reduced. And I can just turn it off like that. Cool thing about this device is it's got a lot of different stored protocols. Also, I didn't really mention, but this device also has specific frequencies. So the frequencies are the way the light goes off and on. So you have the wavelength, right? That's the nanometers, 635 and 805. But then you have the specific frequencies, which is how the light goes off and on. Now, certain frequencies, the light can go off and on like 1,000 times in a few seconds. So you may not see it at all. But those frequencies are designed to harmonize with the tissue and target the ligaments, target the tendon, target the thyroid. So you could have an even better, deeper therapeutic benefit. Erconia, the laser company, did a lot of data, a lot of research on different specific frequency settings, over the last couple decades. So they're kind of a pioneering company on that. And some other companies have taken that data regarding the specific frequencies, and they've added that to the layer, the wavelengths. And so you have the wavelength 635, 805, and then you add the frequency component on top of that, and now you're cooking with fire, right? Now you have a really powerful therapeutic tool to really target thyroid inflammation. And so I love talking about this because I have a thyroid issue, autoimmune, but conventional medical people, there's no options for this, right? They're not going to give you Humira, prednisone, immunoblockers. It's not going to happen. And so what do you have? Well, we try to do all the nutrients we talk about, the selenium and the zinc and the magnesium and CoQ10, and cut out gluten out of your diet. But then what next, right? We want to really dial in other modalities we can to reduce thyroid inflammation. Of course, infections, H. pylori, candida, but now we have low-level laser therapies and other options. So hope you enjoyed today's video. Just did it on myself here, about 3 minutes on each side. About 5 minutes total is a pretty good therapeutic window. And I had that oscillating between 805 and 635 nanometer frequency. Infrared on the 805, 635 on the red. All right, guys, hope you enjoyed. If you have any questions, please feel free, put it down below. Love to see what you guys think, and have an awesome day. Take care, y'all. And again, you want support, you want functional medicine, thyroid support, down below as well. Take care.